All right, well, as we've been telling you, frontline workers are among the first to receive the vaccine. And this morning, we're joined by two of them who are going to get their vaccinations live right now.
That's right. One of them, NBC News medical contributor Dr. Vin Gupta, and his colleague, Dr. Eliot Fagley, critical care section head at Virginia Mason Medical Center in Seattle. Guys, good morning to both of you. Thank you for joining us.
Good morning.
So, Dr. Gupta, you've been in this with us from the beginning. You talked about this. You months ago said you would get the vaccine live on the air with us. So what does it mean to you to be moments away from getting this vaccine?
Well, Al, good morning. First of all, I would say that this is the culmination of a scientific process that's been rigorous, that's been time-tested, and Americans need to feel comfortable with this notion that this is a safe and effective vaccine. So I'm really thrilled and privileged to join my colleague, Dr. Fagley, to lead by example.
And Dr. Fagley, you've been on the front lines as well treating COVID patients. Is personal risk something that has always been in the back of your mind? And how will you go forward now after you get this vaccine?
Well, that's a great question. Of course, personal risk has been sort of top of mind during all of this. As we started taking care of these patients at the very beginning, we really didn't have a great idea of what we were up against necessarily. As time has gone on, we've obviously gotten more familiar with caring for these patients. But even after the vaccine, I don't know that things are really going to change all that much in terms of the way we protect ourselves, mainly because we need to continue to protect ourselves so that we can keep protecting the rest of the community as we finish taking care of some of these patients and then head back home to care for our loved ones.
Absolutely. Well, we appreciate all that you guys are doing. So let's get right to it. Are you ready? Just so everybody at home knows, we're going to have Nurse Allison come out now. She'll administer the vaccine.
Absolutely.
And while she's doing that, Allison, you can come on in.
Allison, come on over.
Can you hear me, Allison? Oh, she can't hear me, so she's just going to do what she has to do. Dr. Fagley, I don't know if you can talk and get a shot at the same time, but if you can, I couldn't.
I can't.
I know, there's no way. I'd close my eyes and wince. So the other one of you guys can.
I'll do my best.
Okay, either one of you can answer this question. You've got those cowboy boots on. This fellow Kansan noticed that. Tell us about the logistics here. What can people expect who are in line? Oh, my gosh, I'm talking to you and I feel bad that you're getting a shot.
Squirm.
Do you want me to ask you? Are you sure? Okay.
He's a pro.
All right. So for the people who are getting this Pfizer vaccine, what can they expect?
Well, we're expecting that it'll probably be something similar to the flu shot. There'll be a little bit of local discomfort, just like anytime you get any vaccine. Some folks may have symptoms, some folks may not. So we're expecting to, feel like we have a little bit of a reaction to just about any other type of shot.
This is just wild. This is the COVID vaccine.
I wish you could
this
see
is the vaccine we've been waiting for since the beginning.
Big deal.
I'm smiling as big as I'm smiling as big as I can under my mask, but it's hard to tell.
Hey, Dr. Gupta, you and I have talked about this a number of times, especially since word of a vaccine started. For folks who are watching or listening who might be scared or skeptical, what's your message to them as you get ready to get your vaccine as well?
Craig, I'm really glad you asked that. The first message is similar to what I said up front, which is to say that we know this vaccine is safe and effective. We know that it's particularly safe in preventing severe pneumonia from COVID-19, meaning you're not going to see docs like Dr. Fagley and I in an ICU if you get the vaccine. So that's first and foremost. I think we need to keep that top of mind, that this is going to save people's lives, this vaccine. We also know it's safe, that there's, at worst, mild side effects, injection site soreness potentially, maybe a low-grade temperature, a headache, but those go away within 24 hours, so that's pretty clear as well. And lastly, I will say is, for those who might have severe allergic reactions, I know there's been a lot of questions about that, severe allergic reactions, should you get the vaccine? What's clear is that if you have that profile, talk to your clinical provider, talk to them about what types of allergic reactions you've had in the past, and you're likely still going to be just fine if you get the vaccine in a monitored setting. So it's going to be really important for all of us to understand that this vaccine, Craig, is the only way out of this pandemic. It's broadly safe. We're learning more, as Dr. Fagley just mentioned, we're learning more about how long immunity lasts. How long are we protected after this 2-dose regimen? And that's number one. And then number two, we're going to learn, does this vaccine protect against severe pneumonia? Does it also, we already know that, does it also protect against transmission? That's the key question here. Does this vaccine protect against transmission? Because a vaccine can protect against severe illness leading to the ICU, but it can also potentially still allow for infection where people are unwittingly transmitting the virus.
Yeah.
We're going to have clarity on that question, guys, in the next 2 to 4 weeks, and I think that's going to be really important for the American people.
Wow.
That's great.
Dr. Gupta, Dr. Fagley, a big thanks to both of you, and also Nurse Allison as well, who has a tremendous bedside manner. Thank you, gentlemen. Thank you, thank you, thank you. Not just for today, but for all you've done from the beginning.
Absolutely.
Really terrific.
Hope you're feeling some hope.
And they got Hello Kitty Band-Aids.
I mean, the whole, it's just better. You know, this has been a long time coming. Thank you guys both for joining us this morning.